Hello, and welcome to Chapter 8. In this chapter, we'll explore various models, frameworks, methods, and designs used in implementation research. We've divided the chapter into two sections, so let's get started with the first one. In this section, we distinguish between different theories, models, and frameworks applied in implementation research, enabling you to select those most appropriate and apply them to your implementation research study. This chapter also focuses on formulating research questions that can guide your implementation research study methods. We will also highlight the differences between different study methods and data collection processes for conducting implementation research. In order to cover the material in this chapter comprehensively, we have divided the chapter into 3 units. In Unit 1, this video, we look at understanding relevant theories, models, and frameworks useful for conducting implementation research. In Unit 2, we look at formulating research questions specific to implementation research, as well as identifying different implementation research study methods and their uses and data collection processes for conducting implementation research. And in Unit 3, identifying different implementation research study methods and their uses. Let's start with Unit 1, understanding relevant theories, models, and frameworks useful for conducting implementation research. Implementation research tackles various challenges in putting evidence-based interventions into action within real-world healthcare settings. There are many theories, models, and frameworks used to do this. Why do we need these? Implementation research has a poor theoretical underpinning, making it difficult to understand and explain how and why implementation succeeds or fails. Because of this, it makes it hard to identify factors contributing to implementation success and to develop better strategies for successful implementation. When used in implementation research, theories, models, and frameworks can guide the design and conduct of implementation studies, inform the theoretical and empirical thinking of research teams, aid interpretation of findings, and guide all phases as research findings are transferred into policy and practice. Let's look at an example of why we need theories, models, and frameworks in implementation research. We will use this same example throughout the chapter to illustrate the different sections. Bangladesh's expanded program of immunization is piloting a digital system for tracking immunization-eligible children, called the eTracker. Before scaling up this digital app, implementation research was conducted on the system to assess the challenges and solutions for facilitating scale-up. Qualitative interviews were conducted, where participants were asked about their perspectives on the eTracker. One participant said the following: "The guideline given states the objectives of eTracker, how to use it, the operating system, troubleshooting, etc. I understand the app, and our younger health assistants can work the app by following the guidelines, but some of our older members cannot even download the app. They need assistance from others. For them, the guideline is not enough. If we use a framework with individual and intervention level factors, we will be able to systematically organize information into the categories of either facilitator and/or barrier. These categories include 1. Intervention characteristic, which is a characteristic of the intervention itself. In this example, the guideline for digital intervention, EPI eTracker, was comprehensive. 2. Individual characteristics, which are characteristics of those implementing the evidence-informed intervention. In this case study, elderly workers experienced challenges using the EPI eTracker. 3. Inner setting, these are the characteristics of the organizational environment. In the case study, the friendly environment within the implementing organization meant that younger colleagues were able to work with their elderly colleagues to overcome their challenges in using the EPI tracker. Now let's see what we understand by theories, models, and frameworks. A theory may be defined as a set of analytical principles or statements designed to structure our observation, understanding and explanation of the world. A model typically involves a deliberate simplification of a phenomenon or a specific aspect of a phenomenon. Frameworks tend to organize, explain, or describe information and the range and relationships between concepts, including some which delineate processes and therefore are useful for communication. When we look at theories and models, they usually give us reasons why things happen, showing how different parts are connected. But when it comes to a framework, it might not always assume that one thing causes another. A framework is more concerned with organizing ideas, or factors, without assuming a direct cause-and-effect relationship between them. There are three overarching aims when using theories, models, and frameworks. These are: 1. Describing and/or guiding the process of translating research into practice. 2. Understanding and/or explaining what influences implementation outcomes. And 3. Evaluating the implementation. The 5 categories of theoretical approaches used in implementation science are: 1. Process models. 2. Determinant frameworks. 3. Classic theories. 4. Implementation theories. And 5. Evaluation frameworks. We will now briefly describe each of these theoretical approaches. Process models widely accept that the knowledge gathered through research can lead to improved health outcomes. They are used to describe and/or guide the process of translating research into practice, that is, knowledge translation. They outline phases, or stages, of the research-to-practice process, from discovery and production of research-based knowledge to implementation and use of research in various settings. One of the most commonly used frameworks, under process models, is the KTA, Knowledge to Action, framework. The KTA framework is adopted by the Canadian Institutes of Health Research, CIHR, and other organizations worldwide. The KTA framework is composed of 2 distinct, but related components: 1. Knowledge creation, and 2. The action cycle. The first component of the model is the knowledge creation funnel, which represents the production and synthesis of knowledge. And the action cycle includes a range of activities needed for knowledge implementation. The determinant framework is used to describe and identify general types of determinants that influence implementation outcomes. It also specifies types of determinants which could act as barriers and facilitators that influence implementation outcomes at different levels. The consolidated framework for implementation research, mentioned earlier, is an example of a determinant framework. It has 5 domains: intervention characteristic, outer setting, inner setting, characteristics of individuals, and process for organizing factors that may facilitate or hinder the effective implementation of an evidence-informed intervention. If we go back to the example given previously, about the eTracker app, we can organize the findings from that study, under these domains, to describe the determinants influencing the scaling up of the eTracker. For example, additional findings from that study indicate that because the eTracker is a new digital app, technical resources are needed for it to be implemented, and implementers need to be familiar with using it. Also, implementers were entering information twice, both manually and in the app, as they were required to keep a hard copy of the population record. The beneficiaries also need to have a mobile phone to get the vaccination reminders. Access to a mobile phone would likely be determined by their socio-economic status. Classic theories originate from fields external to implementation science, for example, psychology, sociology, and organizational theory. One famous classic theory is the theory of diffusion, which is a theory of knowledge utilization broadly used in implementation science. Through this process, knowledge or innovation could be communicated through various channels to a targeted audience. Implementation theories are developed by implementation researchers, either from scratch or by adapting existing theories and concepts. They provide the understanding and/or explanation of aspects of implementation. COM-B, capability, opportunity, motivation, and behavior, is one of these theories, explaining capability, opportunity, and motivation that influence behavior. Again, opportunity and capability can influence motivation, while practicing a behavior can alter capability, motivation, and opportunity. Evaluation frameworks provide a structure for evaluating implementation activities. One famous framework that originated in public health is RE-AIM. It explains an intervention through 5 domains: reach, effectiveness, adoption, implementation, and maintenance. If we again provide the example of the eTracker app, the framework explains the coverage, impact, whether the app is being adopted by the implementers and beneficiaries, the implementation process, and scale-up of the app. Now that we have learnt about different frameworks, let's see how you can use this information to choose the right implementation frameworks for a specific implementation research study. First, identify the goals of the framework, as these will describe or guide the implementation process. Analyze what impacts outcomes. And evaluate the implementation. Some examples include a framework for understanding and testing determinants, for example CFIR, and another for evaluating outcomes, for example RE-AIM. In this section, we distinguished between the different theories, models, and frameworks available to help in implementation research, enabling you to select those most appropriate and apply them to your implementation research study. We also looked at the 5 different theoretical frameworks used in implementation research. These are process model, determinant frameworks, classic theories, implementation theories, and evaluation frameworks. Join us for part 2, where we'll explore how to craft research questions for implementation research, recognize diverse study methodologies and their applications, and learn essential data gathering procedures.